Disclaimer: We Level Up is not promoting the use of Keppra and alcohol. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss mixing Keppra and alcohol. Alcohol and Keppra should not be used together. When people take prescription or over-the-counter medications, they should be aware if interactions with other drugs or substances, like alcohol, are possible. Drinking while taking Keppra can increase your risk of side effects and seizure threat if you drink heavily. What happens if you take Keppra and don't need it? Taking Keppra, the brand name for Levetiracetam, and alcohol together is never advised because of how intense the side effects can be. The consequences can range from dizziness and headaches to suicidal thoughts and hallucinations. Alcohol can increase the risk of side effects when taking Keppra since it can increase the sedative effects. It is important to talk to your doctor if you plan to consume any alcohol while taking Keppra. It is generally advised to avoid drinking alcohol when taking medications for seizure disorders. Keep reading to learn more about how it can affect your health. Keppra and alcohol interaction. The interaction between Keppra and alcohol is not widely understood. Generally, alcohol should be avoided while taking Keppra as it can cause increases in the levels of Keppra in the bloodstream, and can also increase the likelihood of side effects. The most common side effects associated with Keppra include dizziness and drowsiness, and the combination of alcohol and Keppra could further exacerbate those effects. Other potential side effects of combining Keppra and alcohol include stomach pain, blurred vision, or changes in mood or behavior. In some cases, seizures or other adverse reactions have occurred. Keppra and alcohol death. While deaths related to the combination of Keppra and alcohol have been reported, this is rare. It's important to seek immediate medical attention if you or someone you know has consumed Keppra and alcohol and is experiencing any of the symptoms of a Keppra and alcohol overdose. What is Keppra? Keppra is an anti-epileptic drug available as 250 mg, blue, 500 mg, yellow, 750 mg, orange, and 1000 mg, white, tablets, and as transparent, colorless, grape-flavored liquid, 100 mg per milliliter, for oral administration. Levetiracetam is the generic name of Keppra and is used alone and with other medications to control partial onset seizures, seizures that involve only one part of the brain, in adults. In 2000, the FDA approved using the oral formulation as adjunctive therapy for focal seizures, myoclonic seizures, and primary generalized seizures. Both Keppra and alcohol affect the nervous system, and they can heighten the side effects of each other. The severity of Keppra detox makes it a process that should be approached carefully. Does Keppra cause depression? Keppra depression may also cause aggression, anxiety, and irritability. Keppra may cause drowsiness or coordination difficulties and affect your ability to drive or operate machinery. What does Keppra do? Does Keppra work? The understanding of how Keppra works is not very well described. How does Keppra prevent seizures? It is believed to inhibit calcium release in neurons, and this action modulates the firing of neurons in the central nervous system, CNS. Since epilepsy is a disease where neurons in the brain fire uncontrollably, inducing seizures, Keppra slows down this uncontrollable firing in neurons and thus hinders seizures. Although Keppra is a prescription drug, this medication is not a controlled substance and is not monitored by the United States Drug Enforcement Administration, DEA. Can I drink alcohol while taking Keppra? And can too much Keppra cause seizures? Drinking while taking Keppra can have adverse side effects and increase your risk of seizure attacks. Keppra works as an anticonvulsant and has also been studied as a possible treatment for alcoholism, primarily for alcohol withdrawal symptoms. Although, according to the National Center for Biotechnology Information, NCBI, the efficacy data for Levetiracetam, Keppra, in alcoholism treatment has been mixed. There is also preclinical evidence that Levetiracetam reduces alcohol consumption by altering the endorphin release. Moreover, a different study shows Levetiracetam may also have efficacy in alcohol-dependent subjects with co-occurring psychiatric disorders, alcohol dependence and anxiety disorder. Side effects of mixing alcohol and Keppra. There are a few side effects connected with Keppra. One of the most severe is suicidal thoughts. Physicians warn patients to watch their mood when prescribed this drug, monitor for any changes, and report them as they experience them. Does Keppra make you tired? In some cases, it can because it also causes sleepiness. This medication can also impair your reaction or confuse your thinking, so you should be aware of this if you take it and need to do something requiring you to be alert, like driving. If you become pregnant while taking Keppra, it's vital to continue using this medicine unless your physician says otherwise. This is because having a pregnant seizure can be extremely dangerous for your baby. Outside of possible side effects of mixing Keppra and alcohol, potential side effects of using Keppra can include bruising, feeling tired or weak, tingling and numbness, muscle weakness, changes in mood or behavior, hallucinations, coordination problems, confusion, problems with walking or movement, skin reactions, signs of infection. How long does Keppra stay in your system? How long does Levetiracetam take to work? Or how long does it take Keppra to work? This medication usually takes 1-2 hours before it takes effect. It may take about 44 hours for Keppra to be out of your system. The elimination half-life of a drug is the time it takes for blood levels of the drug to be reduced by half. It takes approximately 5.5x elimination half-life for a drug to be out of your system. What is the half-life of Keppra? Keppra half-life of adults is 7 ± 1 hour and is unaffected by either dose or repeated administration. Therefore, it can take about 44 hours, 5.5 by 8 hours, for Keppra to be eliminated. Metabolism, age, health, weight, and the amount and frequency of the drug taken are all factors that can affect the rate at which the body can clear the drug from your system. Keppra, Levetiracetam, belongs to the class of medications called antiepileptics. It is used in combination with other seizure control medications to treat and prevent seizures associated with epilepsy. Keppra overdose. Can you take too much Keppra? And can you overdose on Levetiracetam? According to the U.S. Food and Drugs Administration, FDA, there is no specific antidote for overdose with Keppra. Can you die from Keppra overdose? In overdose, Keppra is sedating and causes respiratory depression. However, recovery is rapid with supportive care. Taking too much Keppra can lead to more severe side effects. It can put someone at risk for an overdose. Can Keppra get you high? It is possible that exceeding 3,000 mg per day could lead to an overdose. It is a Keppra dose too high. Ask your doctor about the option of reducing your Keppra dosage. Keppra overdose symptoms. It is possible to overdose on Keppra. Symptoms of Keppra overdose can include the following: Keppra drowsiness, aggression, fainting, shallow breathing, weakness, agitation. How much Keppra does it take to overdose? In overdose, Levetiracetam is sedating and causes respiratory depression. However, recovery is rapid with supportive care. This is the first reported case of Keppra overdose. Serial serum concentrations suggest first-order elimination even at concentrations 10-40-fold higher than therapeutic. What are the Keppra toxicity symptoms? Keppra toxicity symptoms may include extreme drowsiness, agitation, aggression, shallow breathing, weakness, or fainting. Does Keppra show up on a drug test? No. It will not, because it belongs to a class of drugs known as anticonvulsants, which are not tested in the standard drug testing panels. Treatment for Keppra abuse. What is the protocol for weaning off Keppra? When it comes time to discontinue Keppra, your doctor will advise you on a slowly tapering dosing schedule. Do not just stop it suddenly unless your doctor has instructed you that a rapid withdrawal is justified. The We Level Up NJ Addiction Treatment Center provides proper care with round-the-clock medical staff to assist your recovery through our medically assisted Keppra and alcohol detox program. So, reclaim your life. Call us to speak with one of our treatment specialists. Our counselors know what you are going through and will answer any of your questions. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.